Thank you for watching my presentation. I will be presenting the Eden Alternative Project. My name is Angel Welch and I attend Colorado Christian University. The Eden Alternative Project background. I learned about the Eden Alternative from my Systems in Long-Term Care by Professor Nacardo. The idea of enriching seniors' lives in a nursing home setting really piqued my interest. Dr. William Thomas came up with the Eden Alternative in 1991. The Eden Alternative helps make seniors living in long-term care facilities feel more like a home. This project brings in cats, dogs to pet, birds to tweet songs, potted plants for added color, and vegetables and flower gardens for the green-thumbed seniors. The Eden Alternative Project proposal will be done at Victorian Estates Assisted Living and Nursing Home. There are two contact people for my project. My mentor's name is Christy Edwards. Christy works at Mercy Clinic. Christy's job title is Practice Manager. Christy has been in the healthcare field for over 20 years. She has worked at Mercy Clinic for 2 years. The other contact person is Tasha Winship. Tasha is a healthcare administrator at Victorian Estates. Tasha has been running Victorian Estates for the last year and a half as a healthcare administrator, and before that, she was the director of nursing. The needs assessment. On 2 previous visits to Victorian Estates Assisted Living and Nursing Homes, the residents were sitting in the hallway or in their rooms. No one was talking or visiting with the residents. There weren't any activities going on during both of my visits. My first visit was 2 o'clock in the afternoon, and then the second visit was 10 a.m. There weren't any plants, flowers, or even a fish tank to give off color or spice up the residents' lives. There was an open park in the middle of the buildings with a gazebo, but there wasn't any seating for the residents to go out and be able to enjoy the sun. This space would be great for a cat or a dog to get some exercise without being able to escape or have to be on a leash. There is room for a garden with flowers and vegetables for the residents to enjoy. Victorian Estates is a pet-friendly home, but there are no pets. The stakeholders. The stakeholders in this project are the residents, the staff, and the facility. The residents are given a better quality of life with the Eden Alternative, according to Schick. Schick goes on to say that studies have found greater job satisfaction for the staff, quality of life improved for the residents, and surveys with higher satisfaction ratings help the nursing home. 2 goals to be accomplished is 1, building relationships. The staff and residents are able to grow relationships in the nursing home with the Eden Alternative in place. The staff and residents can bond over their love for gardening and animals. The Eden Alternative helps the residents to be less lonely, less bored, and to feel less helpless. With the residents having a better quality of life, the residents' families are happier with the care of their loved ones. Victorian Estates will also get more prospective residents looking for a better quality of life. The first stakeholder I would like to talk about is the residents and their families. And the residents and their families would support this project. By the residents interacting with children, cats, dogs, and having plants and flowers, the residents are more likely to interact with other residents. The children can help the residents to feel wanted, useful, and more outgoing. The cats and the dogs can help the residents with social interactions by caring for the pet. The interaction of caring for the pets helps the residents with daily activities like feeding, walking, and brushing, according to Hunem. The residents that care for the garden and flowers are more relaxed, enjoy their plants, and are providing a service in fresh vegetables. The second stakeholder I would like to talk about is the staff. The staff might think the Eden Alternative will have a negative impact on their jobs, but in fact, it will have a better impact on their jobs. The certified nurses assistants, or the CNAs, are the hands and feet of the nursing home. The CNAs are making decisions on care and dealing with the emotional needs of the residents. The Eden alternative will make it easier on the CNAs because the residents will be more interactive and social. A study found a resident can have as little as 30 minutes a week with a dog or a cat, and it will show them being less lonely, according to Brune. The residents have a better outlook on life with their pet interactions. The CNA's work can be a little easier with less grumpy residents to help. The third stakeholder I would like to talk about is the board of directors, because they will need to be informed of the decision about the Eden project. The Eden Alternatives President and CEO Jill Valente Asinum has written a book about changing the status quo of senior living. The Health Professionals Press did an interview with Jill about her book. In the interview, Jill talks about changing the culture of a nursing home from a customer service path to a more independent nature. The seniors will go from helpless to a valued member of their own community by helping themselves and each other. By adding the Eden alternative to Victorian estates, the residents are taking another step to being a valued member and building a place in their own community instead of sitting by themselves, lonely, bored, and helpless. The quality of life is a very important part of keeping the residents interacting and each other and the staff. Activity levels go up and the residents are happier. When the residents are happier, there is a higher levels of satisfaction from the residents and their families. With higher level of satisfaction, it is easier to keep prospective residents coming to look at Victorian estates. This will ultimately help the bottom line with the budget. Meeting with the three stakeholder groups. The first group we would be meeting with are the residents and their families. When meeting with the residents and their families, you want to give them the information in a very positive attitude. Give the information on a healthier, happier, and being valued member of the community and being excited about the changes at Victorian Estates for the residents. We need to emphasize the better quality of life with less boredom, less loneliness, and less helplessness. The communication approach taken with the residents and their families would be friendly and show excitement about the changes happening in their community by giving the residents ownership of the changes ahead. With these changes, you will need their help to sign up to take care of the gardens and the flowers, the cats and the dogs, the fish tanks and the birds. The second stakeholder I would like to talk about with the meeting is the staff of Victorian Estate. There would be a team meeting with all the employees to give out the information about the project. Get the staff really excited about the changing the culture of the nursing home. Be very positive and get excited about the changes. Talking about the Eden alternative by making their jobs easier. Let the staff know that after the effective installation of the program, there will be a big party for their hard work and to celebrate the completion of the program. The communication approach to be taken with the staff would be that they are equals. The Eden alternative will make their jobs easier, and you want to emphasize that. The third stakeholder group I would be meeting with is the board of directors. I would give the presentation to show the board what the Eden alternative is, how much it will cost, and what the bottom line of the project will mean for Victorian Estates. I would show the information about licensures, getting registered as an Eden alternative home, show the veterinary care outreach program, the cleanup for the animals, and answer any more questions. The board wants the bottom line. I would get straight to the point with the benefits of the program. Better job satisfaction for the staff with less turnover, healthier and happier residents, and more prospective residents coming into a Victorian estate. Resources and tools needed for the Eden Alternative. There will be a few resources needed to accomplish the Eden Alternative at Victorian estates. Getting registered as an Eden Alternative. According to Thomas, there was 10 principles to becoming a registered facility. The principles are listed in his book on page 66. The Registry for the Eden Alternative provides resources, help, and education information for helping with the transition. Resources will be needed for buying the animals and veterinary exams. Visiting a veterinary to see if they would donate their services as a community outreach program. Hire a caretaker or use volunteers for care of the animals. Residents can also help by taking care of the animals, like providing brushing, feeding, exercise for the cats and the dogs, watering the plants, weeding the gardens, and feeding the birds and the fish. The tools needed? I would use Lean Six Sigma. Lean Six Sigma would work really well in this case for measuring needs and assessing the project. The project can be laid out and revised as needed. The baseline. The baseline would be pretty easy to measure, I think. I would make 3 unannounced times to go in and watch the interaction between all of the residents. The times I would go in are 9:30 a.m., 2 p.m., and 4:15 on different days, and stay about a half an hour to collect my data. I would answer these questions. Are the residents sitting by themselves or in their rooms? I would then count how many residents are interacting with each other, and then I would count how many residents are sitting by themselves or in their room alone. Once I did that, I would add all 3 visits of the residents sitting by themselves or in their room. This number will be the baseline for the residents not interacting with each other. Then I would add the 3 visits for the residents interacting with each other, then divide by 3. This number will be the baseline for the residents interacting with their community. And once you have the baseline, once the Eden Alternative is in place, you can see how much the interaction of the residents goes up after 6 months. Here are my references for the 5 sources I cited in my presentation. Thank you again for watching my presentation. All of the photos were taken by me, except the one free stock photo of the nurse that I used.